Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello and welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host today. And today with me I have a co-host, Landis Feltz. She is our hygienist and she's a myofunctional therapist that works in our clinic, the Stewart Center for Optimal Health. You know, the body is tied together by nerves, muscles, bones, ligaments, but there's a system that runs through the body called fascia. And I guess the best way that you could describe that is kind of like the webbing that holds all the organs in place, and they're not just floating around in your body. They're actually held in place by this really tough, but it's a really miraculous tissue, and we call it fascia. Fascia can be our friend, but fascia can also be our enemy. For instance, there is one fascial system that runs from the base of the tongue all the way down through the neck, through the shoulders, through the thoracic region, through the abdominal region, through the pelvic region, down the legs, and it ends at your tippy toes. So literally almost from the top of your head to the bottom of your feet. And there's actually a fascia that does run through the skin and the muscles around the head as well. Today, it's my pleasure we have a great friend of our clinic and a wonderful colleague and just a great friend in general. She is an orofacial myofunctional therapist, one of the leading in the world, Sarah Hornsby, and we're so happy to have her with us today. She's actually taking a little break she's at an office right now doing some teaching. So Sarah, we want to welcome you and thank you so much for being here. I'd like you to tell a little bit about yourself and then we'll get going.
Thank you, Hal. I'm so happy to be here, and it's good to see Candace too. Yeah. Let me just turn my volume up. Sorry. Okay. Yes, so I do something called myofunctional therapy, and I'm also a dental hygienist, just like Landis. And the interesting thing is that the therapy that I do now actually connects to dentistry in a ton of ways that I'm excited to get into today. I'm sure we'll talk about that later. But yes, I'm a dental hygienist. I've been doing myofunctional therapy for the past 10 years. Now I work closely with a group called the Breed Institute, where I teach training for dentists and hygienists, and that's how I got to know you guys. And I'm really excited to be here and to share more about myofunctional therapy and breathing and pretty much whatever you think is valuable for your patients to know.
Well, Sarah, we're so excited for this because this is a little it's I guess in the industry, if you will, it's still not really well known, much less out in the general public. But it is so crucial to what we do as airway specialists and craniofacial growth specialists, especially when you're talking about adults as well. But you know, when you're talking about children, even infants. I mean, newborn infants, when they come out of the womb, these children, these little infants are a lot of times they're all really knotted up and oral myofacial functional therapists might not be involved, immediately then, but we look and we identify tongue tie and things like that, and the myofunctional therapists are so very important. So, Sarah, give us a broad description of what is myofunctional therapy and why is it important?
Yeah, it's such a good question because it's not something, you're right, it's not something that most dentists and hygienists and healthcare providers have ever heard of. So I think that even makes it more challenging for patients to find the therapist and to get the treatment that they often need. You mentioned the fascia, and I think the reason you're bringing that up, I'll just try to connect the dots, is because so much of what I do is working with the muscles of the mouth and face and specifically the tongue. So a tongue tie can really affect that whole chain of fascia down the body that you're talking about. Now, I guess quick description of what I do is I teach people exercises. It's just like physical therapy, but the exercises are designed for the muscles of the mouth and face and specifically the tongue. So I've got 4 really, really simple goals when I work with all of my patients. And Landis knows this is what I teach in my course. We just have to drill it down to the most basic things. What are we trying to do? Every person that comes through my practice, I want to breathe through their nose all day and all night. I want them to have a lip seal. That means their lips rest closed together. Their mouth is not open. They should have their tongue in the top of their mouth, in the palate. The entire tongue needs to go across the entire roof of the mouth. And then the 4th goal is that they need to swallow correctly. So in our field, we're trying to avoid swallowing with a tongue thrust. And that's something we can talk more about. But basically, it's a dysfunctional swallowing pattern that's pretty common if you're tongue-tied or if you're mouth breathing. So these are really the simple goals that we want all of our patients to achieve. And the interesting thing about this is, to be completely honest, you should not need a myofunctional therapist to achieve these goals. These are things we should be doing naturally from the day we're born. We should never have to think about it. We should never have to be taught how to do these things. And so I think that's the message that I try to get across to people, is that all I'm really trying to do is restore the normal function that you should have with your tongue and mouth and breathing. And that's it. It's really actually pretty simple. Of course, in practice, there's a lot more to it, but that's it.
So you mentioned 4 things. Let's briefly go through those one at a time. Breathing through the nose, you mentioned that first. Tell us why breathing through the nose is so important.
Well, it's a big deal, actually. It sounds like, who cares if you breathe through your nose or your mouth? It's all oxygen. It's all air, right? And I've actually had ENTs say that to me, and that surprises me, because the air that we breathe, the oxygen that we breathe, it's actually very different if it does go through your nose. When we breathe through our nose, we get a couple really cool things that happen. The nose cleans the air, it filters the air, it adds moisture to the air. And the thing that most people don't know about is it gives you nitric oxide. So when you breathe in through your nose, your upper airway is basically bathed in this molecule called nitric oxide. And it's really cool because it's antimicrobial, antiviral, anti-inflammatory, and it's really part of our immune system. So if you breathe through your mouth, you completely bypass all of those amazing beneficial things that our nose is designed to do. If you breathe through your mouth, you're going to be a lot more affected by allergies, by dust in the air, and you're more likely to get sick because you don't have that part of your immune system, that nitric oxide, helping keep your upper airway clean and basically healthy. So hopefully that's just one thing. I mean, I could talk about more, but what do you think about that?
I think that's great. I tell my patients, you can eat junk food every day and live for, decades and decades, or you can eat whole foods, organic grown vegetables, and eat correctly, and your quality of life during that period is going to be much different than if all you do is eat junk food. So yeah, we can breathing through our mouth, but the breathing through our nose is like eating organic grown natural foods in the right amounts. So
For sure.
So breathing through the nose. So the second thing you mentioned, lips sealed. Now, obviously, our lips don't have to be sealed all the time. We talk. Sometimes, if we yawn or, mouth's going to come open. But the majority of the time when we're quiet, when we're just, reading, watching TV, walking around, our lips should be sealed. Now, why is that? Why is lips being sealed important?
Yeah, and some people think, why are you separating this? If you're mouth breathing, your mouth is open. So are they two different things or not? And in reality, most people, if they're mouth breathing, they're not going to have a lip seal. But there are some people who they keep their mouth closed for the most part. And then as they're going throughout their day, they end up opening the mouth, maybe breathing through it once every, 2, 5, 10 minutes. And so paying attention to your lips can really help you realize if you're doing that. Now, having a lip seal on the outside will also help your teeth. So it sounds funny, but you know this. Our tongue is meant to kind of provide support internally for the palate and the teeth. And then on the outside, the lips and the cheeks and the muscles of the face create this countering force that keeps everything in harmony. So in theory, when your tongue is up and your mouth is closed, now the teeth are going to stay straight in alignment, and they're going to, develop optimally if you're doing that from the time you're a baby and you grow into a child, teenager, adult, all throughout your lifetime. So having the lips together is very important for optimal breathing, and it's a sign that a lot of people can pick up on themselves. So most people, it's really funny, they won't actually relate to or admit to being a mouth breather. But if you ask them, or if you're listening and you ask yourself, does my mouth rest open sometimes? That's actually a lot easier of a question for people to be asked and to observe in themselves. So it's interesting that it's just a slight rephrasing of the same thing, but it can make a difference in a lot of ways when you're talking to people.
And so you touched on the third thing, the tongue being up at the roof of the mouth. Mm-hmm. As a craniofacial development expert, I would tell you that as a child, if your tongue is not up in the roof of your mouth, then the scaffolding for your entire jaw and your face is compromised. The tongue is actually the scaffolding for the jaw. And beautiful faces are the architect of beautiful faces. First is the tongue, and healthy faces, I should say, as well. Tell us, Sarah, the tongue being up, and you touched on it a little bit, but the tongue being up in the roof of the mouth, during a swallow, mm-hmm. What happens during that swallow if the tongue is in its correct position? And then that would lead us to the fourth point, swallowing correctly. Tell mm-hmm. us how a dysfunctional swallow can adversely affect the face.
Yeah, so with the tongue being in the roof of the mouth, I'll go into this a little bit because I think for people listening, it's really helpful to kind of visualize and understand how this should actually be. So a lot of times when people think about their tongue, they think about just the very tip of the tongue and going up to kind of the gums behind the upper front teeth. But in reality, your whole tongue needs to fill up three-dimensionally. It needs to take up the entire space of your mouth. Now, the challenge with this is that going back to what we talked about in the very beginning, if you have a tongue tie, you physically don't have the ability to put your tongue in that healthy, optimal resting position that will guide the growth of your jaws, just like you're talking about, and help with your teeth and all this craniofacial development. So this is really where the tongue tie conversation comes in, because if you physically don't have the ability to lift your tongue and keep it where it should be, now we have to start looking at things like surgery. So a lot of people don't understand why all of a sudden we're looking at these tongue ties, but it's because now I think in dentistry in general, we're starting to look more at breathing and a lot of these things that we've never really focused on before. And now we're realizing that a lot of people actually do have these functional issues with their tongue. And in order to have that healthy, optimal function, we need to release the tongue tie. So now the tongue can go up and rest where it should. And that does lead into swallowing. So when you have a dysfunctional swallow, you see a lot of extra movement. So in the face, the lips, the cheeks, the chin, if you're swallowing in a healthy way, in a normal way, you shouldn't see contraction of these muscles. If you're swallowing in a dysfunctional way with a tongue thrust, your tongue will be pushing forward on the inside. Maybe it'll be going out to the side against your molars. But you will also see extra movement of the chin, of the lips, of the cheek muscles. And this tells me that there are some problems happening with the muscles, and they're compensating and they're recruiting and they're not being used the way they should. And so the tongue thrust is one part of that, but also the kind of side effect of the facial muscles having to work extra hard to compensate for the tongue not doing its full job. That's really the dysfunctional swallow and the tongue thrust swallowing pattern that we're trying to correct during the therapy.
The tongue, Sarah, I always tell my patients the tongue is the strongest muscle in the body for its size. and it's
Yeah.
it's never neutral. It either works for you or against you. And a couple of things that people might not be aware of, when people develop astigmatism in your eyes, and you think, okay, how does this have, what does astigmatism have to do with the tongue? Astigmatism develops over a period of time in the human beings, in the eye sockets, the orbits where they're formed, where the eyeball is formed. If that orbit, if the hard shell covering the eye is not formed correctly, the eyeball itself will be disformed, and that's how astigmatism occurs. So if the floor of the orbits is basically the roof of the mouth. So
Yeah.
if the mouth doesn't form correctly, if the upper jaw doesn't form correctly, there's a very high chance the orbits that houses the eyes won't form correctly, and astigmatism. So, wow.
I have heard that. It's so fascinating. I worked with an osteopath, Dr. Daniel Lopez. I think he's based out of Colorado. And I read an article by him talking about tongue position and astigmatism, exactly like you're saying. And it does have to do, if your tongue is up, you support the palate. If your palate is supported and grows well, that supports the sinuses and the floor of the orbits. And so your tongue position can definitely affect your eyeball and your eye shape and your vision, which is crazy, right?
Well, it's amazing, but if someone has a brand new Mercedes and they have a fuel filter that's not working, and they start having all kinds of problems with their car, it makes perfect sense to them that, oh, the mechanic told me my fuel filter was bad, so that's why my car's been doing this and that, and that's why it's been, rattling when it gets up to 70 miles an hour, and that's why it keeps shutting down. The body is no different than an automobile in the sense that it's a system. So there's one thing on one end of the body that can affect something on the other end. And the mouth is such a huge part of this, because that's where we eat, that's where we express our emotions, and we communicate, and that's where we breathe. It all comes through this little part right here. And another thing people do, so I'm just throwing this out for our general audience there, you can reduce your wrinkles in your face by swallowing correctly. If you swallow, let me put it on the flip side. If you don't swallow correctly, the wrinkles in your face will, they occur sooner in life, and they get worse faster. So swallowing correctly, there's an aesthetic component to that as well. So if you don't really care about any of the health issues, you just want to, know about the aesthetic issues, that also affects that as well. So swallowing is very important.
And I'm going to interject here and talk about the aesthetic portion of that. Let's talk about the fact, Sarah, will you talk about orthodontia, and will you talk about how the fact that we can have orthodontic relapse? Because, Dr. Stewart, I love that word, is the scaffolding, so people are worried about aesthetics. Well, let's talk about your facial muscles, but let's also talk about how straight your teeth are. You got those braces when you were 12, 15 years old. And what I hear is, you didn't wear your retainer long enough, or you quit wearing your retainer, and now my teeth are all messed up. Sarah, what do you have to say about that?
Yeah, and that's such a good point, Landis. It's so true. So if your tongue is not in the roof of your mouth, the orthodontist can do a really great job at straightening everything out. You can get a nice, beautiful smile. But if you don't have that internal scaffolding, that tongue posture and lip seal too, to balance out these arches that we've just developed, these straight teeth and wide smiles, if you don't have the tongue up, then over time, and it might be 1 year, it might be 10 years, we don't know, the palate will slowly kind of collapse. And what happens when it slowly collapses is that the front teeth start to look more crooked. And so things are overlapping, things are shifting, and a lot of it has to do with that lack of support of the tongue, that the tongue's no longer there, it's not doing its job. So now we start to see crowding teeth, and we call it orthodontic relapse, and it's really, really common. So my whole thing is, why don't we just address the root cause, get the tongue up as part of the orthodontic treatment, and now it's not only going to help with the long-term results of the ortho, but it will also really help the orthodontist while they're taking you through the treatment. Because if your tongue is pushing forward and your mouth is open, now you're in the situation where the dentist or orthodontist who's helping you straighten your teeth, they have an uphill battle. It's so much more challenging. So you can even help your dentist out a little bit by getting your tongue and your lips in the right position.
So Sarah, if you know, a lot of parents out there and they've got, you know, infants, toddlers, you know, adolescents, teenagers, what should they be looking for? How would they go about finding out if their child would benefit from myofunctional therapy, if they need myofunctional therapy? What are some advice you give parents to be looking for?
I think some good advice is to look again at some of those 4 goals that we're talking about. If you notice that your child is mouth breathing, or if you notice that their mouth rests open, those are 2 things that you can really pick up on and hone in on pretty easily. Now, the thing is, not all kids have super obvious symptoms, so a lot of parents miss it. And so you have to kind of look at the bigger picture of what your child has going on. So if you have a kid who's had breathing issues like asthma or allergies, there's a pretty high chance that they also need myofunctional therapy. So if they spend, half of their life not able to breathe very well through their nose because of allergies, or they feel like they can't take a deep breath because they have asthma, they will become mouth breathers. So even if it's not all the time, I think we get concerned when it's like over, gosh, Dr. Zaghi just told me this number. I want to say it's 30% or 50% of the time. If you're mouth breathing more than that, that's when it becomes like a chronic problem. And so, those are things like any type of breathing issue that your kid either has today or that they had in the past. Because a lot of times kids grow out of their asthma, they grow out of allergies. They might have their tonsils or adenoids removed, which is another thing that can affect their breathing. And the challenge is, just because those things go away, doesn't mean that the habits and the residual muscle changes are not left over. Most of the time, the breathing and the muscles have never been addressed. So kids who had breathing issues in the past still need help retraining the muscles and learning how to breathe through the nose. So those are 2 things you can look at. But then, any child who has severe crowding, like really crooked teeth, it's so common that I think every parent should be looking for a myofunctional therapist, just the same way that we all kind of think every kid needs braces. It's just kind of, that's just part of childhood. Everyone needs braces. Well, all the kids who need braces are typically the same kids that need myofunctional therapy. So when you start looking at it through that lens, you realize how common this stuff is. And that's I think kind of the overwhelming part for all of us. Dentists like you and myofunctional therapists like me and Landis, there's a lot of patients who need this, and we see it as this epidemic that no one's really looking that closely at. So I don't know what the answer is, but the more parents know about this, the better it is for their kids.
Well, those are great points. I tell my parents, and I've never seen children in my dental practice, but since we added in the total wellness and craniofacial development, we see a lot of kids. So I just have parents go home. One way that you can tell, well, there's a couple of ways. Like you said, Sarah, if your child has crooked, crowded teeth, that means their jaws are too small. No ifs and buts about it. Our jaws should develop properly so that all of our teeth can come in with actually spacing between them as a youngster, not crowding. They should be side by side, not one in front of the other. And watch your child when they're sleeping. Watch your teenager when they're sleeping. Go in and just watch them 10 minutes an hour for 2 or 3 hours in a row. Go in and sit there for 10 minutes and watch them. If their mouth is open when they're sleeping, if you hear air going in and out, then they're a mouth breather, and there's something going on that's not correct in their oral environment. So those are just a couple of things that parents can do. But you can, going back to my analogy of junk food and healthy food, if you get your child breathing through their nose, the sooner you do that, you'll be amazed at how many of their symptoms go away. ADD, ADHD, hyperactivity, irritability, spontaneous behavior that is, uncontrollable behavior. Things like that are all a result of kids not being able to breathe correctly, not being able to sleep correctly. And and myofunctional therapy is just as much a part of treating that as getting their tonsils out or getting their adenoids out and creating an open airway space. We still have to have the muscle tone and the neuromuscular response to deal with that. So we talked about children. Adults, how do adults, I'm 50 years old. I know I need myofunctional therapy. As a matter of fact, I've started it with the myofunctional therapist that we've been working with for some years now. What do you tell an adult? What are the,
Yeah, it's a perfect transition because I was actually going to say we haven't even touched on some of the really big things that connect to these goals that I'm talking about, and that's the airway issues. So for adults, it's just the same as kids, except our these goals that we're trying to accomplish have not been in existence for they haven't been in place for a long time. So basically any child who is mouth breathing or who is tongue tied or who has these myofunctional issues will at some point progress to some sort of sleep disordered breathing. And that can be snoring, it can be actual sleep apnea, and there's a lot in between. It can be, something called upper airway resistance. I'm not sure if anyone's talked about that on here, but it's basically dysfunctional breathing. And when you don't breathe well, you don't sleep well. And for kids, when they don't sleep well, they're not growing well. For adults, we have the same challenges. Our bodies, if we're not getting into deep sleep, stage 3, stage 4 sleep, because we're constantly being disrupted because of this dysfunctional breathing, our hormonal systems are off. Our immune system is off. We don't have the same emotional resilience. And so all those things that you're talking about with kids who they're more likely to have ADHD type symptoms, they're more likely to have a lot of trouble focusing, behavioral issues. These are definitely related to not only mouth breathing and tongue tie, but to the bigger picture challenges of sleep apnea and sleep disordered breathing. So, to bring it full circle to the adults, all the adults that I work with and you work with, they were all kids with these issues. So they've just had many decades of dysfunction with the low tongue and the mouth breathing and the tongue thrust swallowing and the open mouth posture. So, anyone of any age can benefit. I think, there's a lot of benefits to working with kids because obviously you can guide their growth and you can really change outcomes because you're catching them early. For kids, the therapy, it's more challenging in some ways because they don't understand the big picture. They don't understand that by fixing these things today, we're actually solving problems later. Adults can be challenging because they're more complex. So yes, we correct the same habits and postures and breathing patterns, but now we've got potentially narrow palates. We've got, smaller jaws. We've got diagnosis issues like sleep apnea and chronic, TMD and pain and headaches. And so with adults, they get the therapy. They know they need it and they're really dedicated to doing it. But now it's not just me doing therapy. It's working with a doctor like you who can expand, who can release the tongue tie, who can really help me as the therapist be able to deal with the structure. I can work with the function and the breathing, but I can't work with the structure. And these adult patients have structural challenges and limitations because of their improper function when they were children and while they were growing. So it's interesting that these things, they stay with you for life. And then at some point, you just have to correct it. Hopefully the sooner, the better.
Yeah, you made a great point about working with, doctors like myself. And I say the same thing about working with therapists like you and like Landis. I'm a member of several Facebook groups they're not doctors, they're concerned moms and dads about their children and having these issues, and so many of them are they're not. They're ignorant. I'm not saying that in a bad way. I'm saying I'm ignorant about aeronautical engineering. I'm completely ignorant about that. Doesn't
I'm
mean
ignorant about cars and golf.
Yeah,
So.
right. But they don't. They're looking at, oh well, my child has ABC. Go to a craniosacral therapist. That or go to a myofunctional therapist, or do Botox injections, or it's about looking at the whole system, and myofunctional therapy is a huge part of treating that system, but myofunctional therapy alone won't. I mean, it only gets you so far. What I do for craniofacial development for Dr. Corridor and I, it only gets us so far. We got to work as a team with therapists like Sarah and like Landis. It's like having a racing car. I mean, that pulls into the pit, and you've got some putting fuel in. You got people changing tires. You got other ones putting new spark plugs in. It's kind of like that. It just doesn't happen in 3.4 seconds or whatever that is. But the earlier we can get and identify it, the better. Sarah, what would you say? What's the ideal time? You have a parent out there. They have no idea. What's the first thing they had a child born yesterday. They want to set this child off on the right direction for the rest of their life, so they can, one day be game changers in the world, and they want them to live healthy and happy. You kind of go through a process of what a new parent would do through the years, and then our listeners, they can look at where their child is on that time scale and know where they should start.
Yeah. Well, I think, and this is something I find myself saying more and more, is that it's never too late. I work with a lot of parents, and they have so much guilt because they're like, I have a 5-year-old and I didn't know this when they were born. Or they say, I have a 13-year-old or I have an 18-year-old. And so the best time to start is today. I don't want anyone to feel like it's too late for their kid or for themselves. Like you said, you're 50, you can start this today and it will help you. So it's never too late. But ideally, in a perfect world, and we don't live in a perfect world, we would be screening for tongue ties and breathing issues at birth. And there are a lot of, hospitals that are, but they're not necessarily screening for function. And this is the challenge. So when moms, they have their baby and, someone screens for a tongue tie and they says, oh, they're fine. They're only looking at, one metric, and that is, is the baby gaining weight? That's really what we see with breastfeeding. And what we really need to be figuring out is, is the latch optimal? Is the suck, swallow, breathe pattern optimal? And most hospitals and lactation consultants actually don't look at that. Like, shockingly to me, I think, well, isn't that what they do? But the thing that most patients don't realize, and that I think is the biggest challenge for all of us who are in this field, like you and me and Landis, is that we're doing like really, I guess, cutting edge things in a lot of ways. This isn't mainstream dentistry, and this isn't mainstream medicine. And so for any moms or dads listening out there, you really have to be an advocate for yourself, and you have to do a lot of work to find the dentist like Dr. Stewart, or to find a myofunctional therapist, or to find a lactation consultant who understands the function and the development that comes from optimal feeding and breastfeeding. And it's hard because it's not our paradigm. It's not our way of looking at our patients. And so finding that team is something that I help parents with and patients with all the time. I know how you have to do it too, because we can't do our own therapies and treatments without this other big picture. But our medicine and dental practices are not set up to do this. And so, I think the parents, they can start young, but it's easy to say that. It's hard for the parents sometimes to know what to look for. But I will say that if you just watch your child, keep an eye on these things at any stage of development, if you see that they're behind, maybe with talking, find a speech pathologist or an occupational therapist or someone who understands the function and who can always go back to the breathing and the airway stuff. And I think, one of the things to also think about is these things can't be fixed and then, they never come back. So if I'm working with a 5-year-old, I can help them, we can get optimal function habits today, but these conversations around nasal breathing and keeping your mouth closed, these are conversations parents should have all throughout their child's growth and development years. So all the way until they're like 18, we should be talking about tongue posture, nasal breathing, and lips together, just like we teach our kids about, you can't eat ice cream for dinner, and you have to try to sit up straight, chew with your mouth closed, all the things that we tell our kids as parents. These are things that we should be included: the tongue posture, lip seal, nasal breathing. And so that's a really long answer to what you're saying, but to summarize, I'll just say it's never too late. The earlier, the better. Just make sure that you have that good support team to help you know what to look for.
Well, Sarah and I both are faculty at the Breathe Institute in Los Angeles, and I know that's one place that the general public can go for
sure.
a start, and they would be able to direct them to their part of the country on what to do. I know Sarah, a lot of her patients are, probably the majority of her patients are spread out all over the country, all over the world. Yeah. Mm-hmm. I know Landis is doing some online training or therapy with patients. So myofunctional therapy is something that can be done remotely, but a good place to start would be some place like the Breathe Institute. Just going on their website, and it's a very patient-friendly website that people can get a lot of answers. Sarah, do you have any other maybe reading material, books, websites that people could go to? You could welcome to give your website if you've got information.
There's a handful of books that I like to recommend. I think Dr. Richard Baxter's book, Tongue Tied. There's a book called Jaws that talks a lot about some of these craniofacial development issues and why we have them in our society. There's books by Patrick McEwen about Buteyko breathing called Close Your Mouth. There's a book called Breath by James Nestor. And I think a lot of these books are really helpful places to start if you want to read a book. I love what you said about the Breathe Institute. I'm going to echo that as well, because they've got so much free content for not just patients, but for healthcare providers. So if you are a patient and you're working with a dentist who might not fully get what you're talking about, send a doctor to that website, because it's really helpful for everyone. I have a YouTube channel that has a lot of, I've made like these little 2, 3, 5-minute videos that explain some of these basic little clips. And the reason I did this is exactly really what you're asking me, is where can patients go to find more information? So I started putting together these little short videos for my patients to help them understand and kind of reemphasize what I would talk about during their therapy sessions or during their appointments. And so, you can look that up. I think more and more these days, in the past 5 years, the information is becoming much more accessible and much more mainstream, because now we actually have research around it. So that's something that's really changed probably since 2015. This stuff is being taken a lot more seriously, and there's a lot more information out there. So start with the Breathe Institute, start with those books. You can check out my YouTube videos if you want, but I think those are my favorite recommendations.
Well, you made a great point about research. This is not something that's just pie in the sky made up. There's legitimate scientific research, very good data that supports everything that Sarah has talked about today. So, and the Breathe Institute has been a big part of that, about doing the proper research and the honest research on these things. So there's a lot of information. Derek will put that at the bottom of the screen so people can go to the Breathe Institute, Sarah's channel. Sarah, it's been great having you today, but like we always do, we end with a song, and you've picked a song. We're going to play it, and then you can tell us a little bit about what that means to you, the lyrics of this song. What have you chosen today for us?
It's called Angels Above Me by Stick Figure. And, it's a song, I don't know why I started listening to it. My sister listens to that group a lot, and I just moved to Arizona not too long ago. And so it's just kind of a fun song that makes me think of my sister, and that's pretty much it. It's my favorite song right now. I have tons of favorite songs, but I thought this one's a good one. So
Well, let's listen to it. We'll play a little bit of it here.
The angels above me, they sing that they love me, oh Lord. I'm traveling alone, so far from home and alone. Oh no, angels, angels, please don't leave. I'm trying to get to her with the love she deserves, Lord, please.
That song just makes you want to smile. I can see why. I don't know your sister, but you must really love her because that song is a happy song.
yeah, it's a happy song. It kind of almost has a little bit of like a Hawaiian vibe or something. I lived in Hawaii for a while, so I don't know. It just makes me. It's just a happy kind of good feel good song. So.
Well, great. Well, you know what? Talking with you today has made me feel good, and because I know that it's going to help a lot of people that listen to this podcast, and that's what this is all about. That's why I do what I do. It's why you do what you do, why you do what you do, Landis, because we want to make people healthy, happy, and create harmony in their life. And it's not just about teeth, it's about the whole body. So, Sarah, thank you so much. We'll have you on again sometime, I promise.
Thank you so much, Dr. Stewart.
Get back to your class and help change the world.
Thank you. This has been really fun. Good to see you too, Landis, and have a great rest of your day.
All right, you too. This has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. We'll see you next time. Over and out. Bye-bye.